Okay, so let me ask you some questions now. And this is more specific to the readers who will be reading my book and my website. Most of the people who will be coming will be individuals who've been diagnosed with autoimmune conditions that are labeled incurable.
Yes.
Like medical establishments in this country and in the Western world labeled all autoimmune conditions such as Hashimoto's and Graves, lupus, rheumatoid arthritis, scleroderma, etc. as incurable. Now, this might seem like a silly question, but what is your opinion about autoimmune conditions being incurable?
Well, autoimmune disease basically means that the mind has a role in the manifestation of the disease as well. And the Western medicine refuses to accept that. Therefore, the Western medicine has no medicine for it. So, based on the clairvoyant abilities, I put this modality together, which is called Shafaw, as you know. Shafaw means sacred healing. So in this modality, for example, I observed that, I'm answering your question, by the way. In this modality, I observed that when people are fearful, the fear goes into the space between the navel and the pubic bone. It just goes there. I see when people are insecure, their insecurities goes into the sacrum. It's like, it's being soaked inside the sacrum. So as we age, insecurities build up. And they affect the production of the stem cells. And it affects their transformation, their miraculous transformation from stem cells to being white cells, red cells, platelets. Therefore, they are insecure cells, blood cells. And therefore, we have an insecure immune system. No, an insecure immune system is not a bad system, just like an insecure person is not a bad person. But it's tired. It can't do the kind of thing that it naturally, in its natural state, would have done. So cancer comes, we all get cancer every day. And the immune system cannot do anything about it. Therefore, we have all these fancy schmancy names, Mr. Hashimoto comes from Japan and creates all these difficulties with the thyroid, we have MS. Why? Because the myelin sheath is attacked really by the immune system. And the nerve cells. The immune system attacks the joints. We have arthritis now. So that's why the Western medicine may say is treatable. And people think, they don't know the difference really between treating, curing, and healing. They think, they're going to heal. But the Western medicine does know that they cannot heal the process. It's like, okay, blood pressure is treatable, which means you have to take the medicine till the rest of your life. But the Western medicine cannot do anything about it. It can deal with the symptoms, make it tolerable, which is good. It prevents some people having strokes or heart attacks. But it does not deal with the actual disease. So you know it, I know it, and the patients who've healed, who've come to Shafaw, know it, and we have some testimonials on the web, and they have a lot more testimonials as colorful as the ones on the web that we did not put on the web. Is like, what's the point? We know that once we bring in security into the body, making the body's intelligence to realize that it can heal, then healing can manifest. So all other immune diseases, emphatically, yes, can be healed. Emphatic yes to that question. There is a field of intelligence that runs your body. Once that field of intelligence comes back, she knows how to heal. Healing is her name, you see. So a healer would provide a healing environment for body's intelligence to come back and heal. And no disease is bad enough or big enough. All diseases can heal.
Wonderful.
There are no exceptions.
So let me ask you this. We talk about insecurity being in the body and that's insecure immune system. So then would you say that there is an emotional component to autoimmune disease? for autoimmune conditions?
Absolutely, absolutely. In fact, it's no secret. Most of us know this. No physical healing can manifest without addressing the emotional aspect of it. That's why we have Shafaw and we have Shafaw too. Like Shafaw, in Shafaw, when you come to me, I do like 95% of the work. I do a lot of things. And then you pick up on the momentum and you start to be part of this healing team. In Shafaw 2, I do only maybe a maximum of 20% of the work, and Healy or / the patient does more than 80% of the work, which is dealing with emotional issues. So emotional issues come up, they carry a lot of charges, and when I say charges, I mean charges, electrical charges, and I remove them, and they can't come back. I have had testimonials while doing Shafaw 2, which means the person is doing the most of the work. The Healy is doing the majority, more than 80% of the work. I have testimonials of, after a session, my ovarian tumors are gone. My breast cancer tumor is gone. And I didn't work on them. It's God's honor, cross my heart. I did not work on the tumors. But the tumors went away because the Healy, what we call, sick people. Healy is not patients because we are not doing things medically. Is alternative medicine. Yeah. So we call him here. So the Healy, tells us the tumor is gone, and one of the most important values of the Western way of treating is all these tests. The scans and the tests. They prove there is no tumor, and I did not do the healing. She's done it. But I help prepare a healing environment for the Healy to realize her choices as a partner of creation, as a creator, and as a co-creator, you see. So then the body's intelligence comes back, and the body's intelligence knows what to do. Healing is a given. So emotional aspect, do they have a role? Of course they do. Having said that, I must add that each month we have at least a few calls from all over the world. For some reason we have a following in Australia and Japan and Middle East. Middle East is not strange. In Europe also. They call and say there is a loved one or a friend that is in coma. We always bring them back out of the coma. Always. The person doesn't know me. I don't know the person. They don't believe in what I believe. In fact, they're in coma. But something happens that I do that, like a good operator, I turn switches on and off and the person comes back. Once the person comes back, then it's up to the individual to continue with the healing. So in this system of healing that, we call Shafaw and Shafaw 2, personal belief, I prefer you do not believe in me when you come in. In fact, it's a hindrance rather than a help. So we ask you to come, just be open and see if it works for you. See if your tumors shrink. If they do, then what's the problem? Heal. So yes, emotional aspect definitely play a role, but there are these exceptions here that the person is in coma and they cannot engage in their own healing processes because they're in coma. So in that respect, there are things that we can do that are somewhat different. When you come to me, you are this wonderful, beautiful young lady, and you're very intelligent, and you've been trying different modalities, and you try to find out how I can heal this. You are an active participant in your healing process, like you have been. And therefore healing may expedite. So in your case, healing can expedite. In other cases that people try to be active, the logic, the three magic words gets in the way. They actually sometimes prevent me from doing what I'm doing because they just ask too many logical questions, wasting our precious time during the session.
Which brings me to my next question. You've kind of already touched on it a little bit. What do you feel is the biggest barrier that people have to healing? If you could sum that up with everyone that you've worked with, and
Well, this may be really sticky point, but you know, the fact remains, based on my personal observations, I have a lot of case studies by myself, that when a person comes for healing, they do not necessarily want to heal. You know, it may be strange, but physicians know this. Physicians, actually, you know, Western doctors do know this. They talk about it. And in healing, it's strange for me to say it, but it's true too. You know, a person comes and on the scale of 1 to 10, the headache is 11, 12. They want it to be 1 or 2, but they don't want the headache to go away. In fact, anytime in the past, and I haven't done that for a long time, anytime in the past I just removed the headache, they started to be very critical of me. You know, initially it's like, wow, my headache is gone, and a couple of days later, you know, they started to pick on a few words that I said, you know, I do say words that make people honest with themselves, you know, and then they stop coming. It's like, okay, the person really didn't want to heal. You know, they have secondary investment in the headache, in the disease. You know, they want it to be better, but they don't want the disease to go. Because once the disease is gone, to them, and some consciously, by the way, because they say so, and mostly in subconscious level, then they've lost their identity. They don't know what to do with their lives anymore. So that's the main hindrance, you know, people not wanting to heal. And of course, my job is to prepare a healing environment within which they actually want to heal. That's the biggest challenge that, you know, I face every day.
That's beautiful. Your work is amazing. I can also testimony to that, absolutely.
Thank you.
But I will say this, my closing comment would be, because it's just been such a wonderful interview and you've covered just about all of my questions. For the individuals who want to heal, and for the individuals who think they want to heal,
yes.
What is your best advice for us all?
Well, my best advice is what I practically do. You know, as a healer, I must see where the disharmony is. I must see that, or what am I healing, right? Otherwise, I'll be just a monk praying. You know, and there are invisible helpers that come and help, you know, archangels, so on and so forth, without a question. They come and help when you pray. But I do more. You know, I realize what the disease is, and then I step aside from the disease, and I create a reality opposite to what is. I keep on looking at that new reality. It's like the individual is already healed. I bring that new reality, which is health and abundance and all that, and superimpose it on the old reality, and I keep on looking, and I keep on transmitting energy. I keep on making healing frequencies appear inside the area that is going through disharmony. So my advice to them would be, step aside. See yourself healed already. And you're not faking, you're not in denial, because this pattern is start to repeat. The moment you start to think it, the pattern starts to repeat. You know, we have practically, without exaggeration, hundreds of meditations designed for these purposes. And in one of the meditations, you know, I add 12 years and I ask the individual to see oneself in 12 years from now. And then I bring them back to the here and now, and I ask them please to rehearse being healed. Rehearse. You know, it's like you're rehearsing for the most important role in your life to play. Rehearse it. It's like I can't imagine. Doesn't matter. Rehearse it. Think it. So the rehearsal is to see yourself already healed. If you think you are going to heal in the future, then that pattern is going to repeat. You know, there is a lot of future healings, but it's not happening now.
So they have to imagine themselves as already healed in the moment.
Yes. And, you know, then you go to physician, they say you're not healed, and you lose your ground. but the healing happens a lot of times, Michelle, as you know, almost instantaneously. But it takes some time to manifest. And the urgency, I want to, when you do healing on me, I want to go to lab and all the blood works must be just fine. Well, give it a few hours at least. Because, the body's, the blood needs cleansing, the blood needs to take care of the dead cells and so on and so forth, So there is a due time, linear timing associated because we live in this linear physical universe as well. Everything about it is physical. You drink water and, make the water disappear. Okay. But then, you have to go to the bathroom. So realities of physical holy games in life that you play does matter. And the biggest advice is to step aside from the disease, stop identifying with the disease. We know there is disease, disharmony, we are not in denial, but let's co-create together, or let me help you create, or let me create a reality that is just healing. That is also reality. The supreme consciousness, the universe, all the elements, they really want healing. The universe is not designed for death and destruction, really. It's designed for change, of course, but not for death and destruction, and painfully so. So that would be my advice. Let me do what I do, and let me help you do what you do. And healing is a given.
That's beautiful. Well, thank you, Master Bruce. This has been a wonderful interview. I'm sure my readers are going to enjoy it and offer you a heartwarming personal narrative. It's wonderful for all of us. So thank you so much for your time.
Thank you, Michelle. Okay. Have a good day. Bye-bye now. Blessings. Bye.